doctor in Aurora, whose medical practice is geared towards helping the underserved, is running into a roadblock.
He tried to give COVID-19 vaccines to people living in specific zip codes, but the governor's office told him he couldn't do that.
So he spoke with Denver 7's Lance Hernandez.
It will be fast, I promise.
And the reason we do this is because it helps cut out barriers to care.
Dr. P.J. Parmar is operating a vaccine clinic for the underserved in Aurora's refugee and asylee communities, offering them on a walk-in basis.
Okay, all done.
It's the whole idea of health equity where you're giving them a little bit hand up for people who can't make appointments easily. They don't have the phones, they don't have the computers, they don't have the transportation to get to the places on time.
The state says there can't be any barriers to vaccine access. That threw a monkey wrench into Parmar's plans to help the underserved. When others learned he was offering vaccines,
they quickly flooded our clinic, and we were doing, it wasn't underserved medicine anymore, we were doing overserved medicine. That was a month ago. So I said, no, we're going to change that.
He posted a flyer reaching out to residents in the 80010 zip code, one of the poorest in the metro area. Initially, the flyer said that they had to have proof they lived in the zip code.
Okay, you're off the net.
That drew a letter from Rick Palacio at the governor's office saying it's not allowable for you to offer vaccines exclusively to residents of a single zip code, and it's not permissible for your clinic to require that an ID or proof of residency be presented in order to receive a vaccine. The governor's office now saying they may target specific zip codes, but can't require an ID.
Yes, I got a vaccine from here.
This patient received his vaccine at Parmar's clinic and is helping translate for other refugees.
Definitely he makes everyone, whoever come here, getting more comfortable than going other hospitals.
Parmar now starting a vaccination list.
By sticking my neck out there and trying to push this issue of vaccine equity, absolutely, the state may come in and take away the vaccine supply, in which case that would be really sad for this community.
Lance Hernandez, Denver 7.